Welcome to Empowering Seniors, the web series. I'm Katherine Ambrose, and I'm joined by the healthy neurosurgeon, Dr. Tim Watt. Now, if you've watched our Empowering Seniors television show on Channel 8 in Wichita, the local PBS, KPTS is the local station, Dr. Watt was on a phenomenal episode, and you can still catch that replay. In fact, I'll put it in the thread. Dr. Watt, thanks for joining our web series.
My pleasure.
We appreciate this. It's a great way for us to stay connected with our seminar attendees and different friends out there. And I bet you have some thoughts on what's going on with COVID-19 and how we can best keep ourselves healthy.
Sure. It's the topic on everybody's mind. And of course, I was planning on being down there in Wichita with you in person, but with this virus scare going on, I'm stuck up here in South Dakota at the moment with no clue when I'm going to make it back to Wichita. So thanks for hooking up online.
Yeah.
For a little background, just quickly, yes, I am a neurosurgeon and I still have a day job as a spinal surgeon. I did an operation this morning. But I'm also a board certified anti-aging physician, and I've done fellowships in anti-aging and age management and functional nutrition and metabolic medicine. And when people say, well, what does age management have to do with COVID-19? Well, another way of picturing age management is preventive medicine with an attitude. It's about being healthy and staying healthy. And so I've actually spent the last 18 years very intently studying health and how to optimize health and how to stay healthy. And as this virus has swept across the country, I like to think of it as kind of being an exclamation point or a highlighting of what I've been telling people all along, which is it's time to be responsible for your health, because the healthier you are, the less chance it is that you come down with anything, whether it's a common cold or influenza or COVID-19. And if you do come down with it, it makes all the difference in the world as to whether you're deathly ill or you're one of these people that barely even notices that you're sick. So I'll admit, yes, everybody out there on the internet has an opinion these days, but I like to think that everything I'm going to say to people today has a background in real science and reasonable amount of actual fact, not just opinion. I'll let you know when it's just my opinion.
Okay.
One of the things that we chatted about briefly before we went live are some of the things that people are doing very well-meaningly, but probably inappropriately. First of all, there's no doubt about it that hand washing is at the top of the list of things we need to be doing. And again, I tell people, your mother taught you to wash your hands when you're 4. I'm kind of confused as to why we're having to go over this all over again. But the virus can live on surfaces, and it doesn't matter what you're reading about how long it lives on cardboard versus plastic versus metal versus what, whether it's 2 hours, 20 hours, 50 days. You touch things that are contaminated, it gets on your hand, and then you scratch your face, or a bigger risk, you pick up your ubiquitous cell phone and you hold the phone up to your face. So you might as well have just rubbed your face on whatever you touched. So hand washing is goal number 1. And from the science behind this, there's what's obvious. If you get particles of something on your hand, whether it's dirt from the garden, or bacteria from a little kid, or COVID-19 from who knows who, you wash your hands, you decrease the number of dirty particles on your hands. But viruses are not living things in the sense that you and I are living. They're kind of a molecule on a mission. They're made up of nucleic acids, what your DNA and RNA in your cells are made of. And these are covered in a lipoprotein coat, which is basically fat. And that fatty coat is necessary for the virus to do its job as a virus. Now, what dissolves fat? Soap. So you don't need fancy antimicrobials. You don't need to be sprinkling penicillin powder on your body. You need to wash with soapy water. People are making a run on antibacterial this and antibacterial that. Dawn dishwashing liquid would work great. Okay, it takes the fat off your pots and pans. Guess what else it'll do? It takes the fat coat off the virus particle. And once you've done that, the virus can't do its job, which is getting into your cells and potentially making you sick. Now, here's where one of the common problems comes. You see people wearing gloves. And gloves, gloves cut both ways. If you're wearing your gloves appropriately, yes, they protect your hand. But the problem is the gloves do not put you in a magic envelope of protection. And people make the mistake of thinking just because they're wearing their gloves, they automatically are safe. They don't have to take any other precautions. This started years ago in the food industry, and it was a terrible catastrophe because now you go into a restaurant, there's always the sign, employees must wash their hands. Well, if you remember back when gloves became all the rage in restaurants, you'd see the kitchen staff coming out of the bathroom wearing their gloves.
Oh.
Well, guess what they just did with their gloves on, and guess where they're going now? All right. So the problem, again, to use the same analogy I just gave, handle on the shopping cart probably is filthy. It's always been filthy. I'm married to a germaphobe. She's been wiping those shopping carts down with wipes for years. So you go in, you pull out the shopping cart, and for all you know, some little kid with diarrhea was just sitting in that little seat. So you put your gloves on, and you grab the handle of the shopping cart. You're tooling around, and you're picking things up off the shelf and putting them in the cart. So we'll pretend I'm wearing my glove, and we'll pretend I've touched the handle of the cart, which is contaminated. And now I pick up my coffee cup. I've still got my gloves on, but whatever was on the handle of the shopping cart, I've just transferred to my coffee cup. So I do my shopping. I go out to the car. I peel off my gloves, which, by the way, if you don't take them off correctly, you've just contaminated your hand anyway. And then you reach into the cart and unload all your groceries, which you just touched with your gloves. And you go home and unload them again, put them on the shelf, never thinking you need to wash your hands because, hey, you were wearing your gloves. Okay. Or again, with the cell phone. I see people all the time, they've got a hold of their cell phone with their glove. Well, they've just grabbed something that they've put up next to their face, and whatever was on that glove is now on your phone, and it's now next to your face, which is where you're most likely to have the virus get egress or entry into your body. So, when I do surgery, when I did my operation this morning, yes, I wore gloves. What I didn't do was come out of surgery, still wearing my bloody gloves, and go to the doctor's lounge and have a cup of coffee and eat lunch. That would be ludicrous. If I had a second operation, I wouldn't wear the same pair of gloves for operation number 2 that I wore for operation number 1. But most people out there running around with their gloves are not addressing what we call cross-contamination. So they're spreading stuff all around with their gloves, but they think they're somehow protected. So they're not being cautious about bringing things up to their mouth. I mean, the picture I love that's circulating the internet is the guy holding the glove in his mouth while he touches his cell phone because the touch screen wouldn't register through the glove. Okay. So I don't think that if the guy had not been wearing gloves, he would have touched something he thought was dirty and then stuck his finger in his mouth. But that's what he's doing with the glove.
Yeah. So it's a big learning curve if people haven't been kind of brought up in the medical world or you know, some kind of industry that teaches them about cross-contamination. It's a huge learning curve.
Yeah. And again, I'm not meaning to say people are too ignorant to know how to use gloves. But again, you still see this. You walk into McDonald's, which I hope you're not doing because there's no real food there. But there's the kid in back with his gloves on. He's rubbing his nose and then dishing up your French fries.
Mm-hmm.
So all he's done is kept his snot off his fingers. He hasn't kept it off the fries you're about to eat. So it's very easy for that to backfire on you. Mm-hmm. And then the same thing with masks. People are confused. You know, first, the Surgeon General, who's a very bright man, said, wear masks. Then he said, well, maybe don't wear masks. Well, again, the problem is if you're not wearing the mask correctly, you're doing no good. Yeah, Catherine's got her masks there. But, you know, the other day in the office, I was talking to a patient and he had his mask on. And every time he went to speak, he reached up and he pulled it down over his chin so he could talk. And then he'd put it back up and then he'd pull it down again to talk. And I finally couldn't take it any longer and just said, for Pete's sake, take the thing off. One, you're looking silly, and two, it's doing you no good. And it's important to realize that when you're wearing the mask, most masks, especially the cloth ones, the bandanas, the scarves, all the stuff that people are making themselves, that sort of thing. Mm-hmm. You're wearing that to protect somebody else, not yourself.
Okay.
What you're trying to do is keep any particles that are coming out when you're talking, breathing, coughing from traveling across the room and making someone else sick. Mm-hmm. Unless you have a good quality mask like the one Katherine waved there just a minute ago.
And we had this for cleaning a moldy basement, by the way. We didn't go out and buy them. We just happened to have a few.
Yeah.
And they're hot. They're really uncomfortable.
But again, when you were cleaning your moldy basement, when you're cleaning your moldy basement, you're not wearing it on your chin. You're covering your mouth and your nose. Mm-hmm. And you have to have a good tight fit. You know, there were a lot of pictures on the internet of doctors and nurses, and the captions were, look at these poor healthcare providers who are so bruised from their protective care. Well, I don't want to belittle the job my colleagues are doing, but those aren't bruises, they're tape marks. When I put my mask on for surgery, I tape the edges down so that air's not coming out around it. Mm-hmm. And when you're finished with surgery and you pull that off, you're pulling the tape. And then you put it on the next time and you retape and you pull the tape off. Those are tape marks you're seeing on those doctors and nurses on the internet. So again, if you're going to put on a mask that's got a good fit and or tape down the sides so no air can get out, and then if it's a high quality mask, it's a little hard to breathe through. But again, people wearing them around their neck, wearing them hanging out loose around their face, way out here, down on their chin, it's not doing you any good. And so the problem then is it makes people careless because they think wearing the mask has magically protected them. I saw people just today standing, 8 inches from each other, chatting back and forth, wearing their mask. But the masks were out open to the side, and air's like water. It's going to take the path of least resistance. So if it's hanging loose around your face, the air's not going through the fabric, it's going around it. So again, if you're not doing it right, it's not really helping you. And worse yet, if it lets you convince yourself that you've somehow been magically protected, you start to get a little careless and do things that you otherwise would not have done. And again, I'm not saying don't wear the mask. In some places, they're going to write you a ticket if you're not wearing the mask. But I am asking you to not kid yourself about how much benefit you're getting from it. And there's something to be said for social distancing, and there's absolutely no replacement, again, for warm, soapy water.
Yeah. So bacteria and the virus, those are different things. Would like the Clorox spray and those kind of things be more for bacteria than a virus?
Um, Actually, these disinfectants like bleach and Lysol will kill viruses. And again, no, I don't have the lab study that shows that it's killing COVID-19. But if you get your can of Lysol and read on the label, it says it kills coronavirus. Now, don't think that's a conspiracy theory. It doesn't mean that COVID-19 has been around for 15 years. Corona is a class of viruses. COVID-19 is a subset. But again, a good dose of Lysol kills most of the coronaviruses. It probably kills the COVID-19 also. Does that mean you should spray it up your nose? No. And not to sound harsh, but the people that are silly enough to be drinking Lysol probably deserve what they get. I just hope they haven't had children and passed those genes on yet. But, you know, in terms of again, nobody's wanting to go to the store. We're the same as everybody else in that sense. So yes, Amazon is making deliveries to my house daily. And remember, I'm married to a germaphobe. So the package arrives, the wife goes out on the porch with the Lysol, sprays the box down, rolls it over, so she sprays the whole thing, sets the Lysol down, immediately washes her hands, and she walks away from it for an hour or two. Then she comes back, opens the package, takes out what's in the package, and sprays that down with the Lysol, walks away, washes her hands again, and then finally the goodies make it into the house. Now, is that maybe overkill? Maybe it is, maybe it isn't. But again, the kicker is, if you're going to pick the box up in your hand to spray it with the Lysol, as soon as you set it down, your hand just touched the box. So if you're worried the box has something, your next step is go wash your hands. And it's not answer the phone, pet the dog, swat the kids, unload the dishwasher, and then wash your hands. It's wash first before you touch anything else.
And so my family's doing that. We're wiping down the groceries, we're wiping everything down, wiping the credit card down. And anyway, it is scary. Now, sometimes you hear about some of the other illnesses that have gone around, and why don't we react the way we are to those illnesses? You know, what's the difference?
Well, this is going to generate hate mail somewhere, but I think COVID-19 has a better press agent. Now, I'm not saying it's not a real disease. I'm not saying it's not making people sick. I'm not saying it's not killing susceptible people. But let's face it, these days, the news media and social media has taken on a life of its own. Everything suddenly makes headlines and gets spread around. You know, this is reminding me of when we were kids, and every night you turned on the evening news with Walter Cronkite, and you got the body count from Vietnam. And that's what we're getting now. When the H1N1 went around, when bird flu went around, when the Hong Kong flu went around, when swine flu went around, people died. But what we didn't get was an hourly broadcasting of how many people were sick and how many people died. So this is something that's real, but there's a lot of beating the drums about this. And, you know, it's hard to say whether the motive for this is nefarious or not. Everybody has an opinion, all right? I would like to think that part of the reason this is being stressed so much is that public health officials are wanting everybody to be cautious. And, you know, the way you get people to be cautious is you make a big deal of it and say, hey, you've got to pay attention. And so you stress it and you ramp it up to try to get people's attention. That's well-meaning. Could there be other motivations? Maybe. But again, as we're getting more and more testing done, what we're clearly seeing is that the vast majority of people who get exposed to the COVID-19 and have very, very mild symptoms, or they feel like they've got a bad cold, or they've got just a case of the quote unquote flu, and they haven't even gone to the doctor. And I'm really confident that if the time ever comes when we're able to do antibody testing for large segments of the population, we're going to find out that the death rate is much less than what was originally projected. You have to remember that these types of numbers are fractions. Okay, so everybody's homeschooling their kids now, lesson in fractions. The numerator above, the denominator below. So the death rate is how many people that die of the disease divided by how many people that have the disease. Well, early on, when we didn't have a lot of testing, the only people getting tested are the people in the hospital that are deathly ill. Mm-hmm. So if you're only checking people that are already on death's doorstep, guess what? It looks like everybody's dying and the number's horrible. Mm-hmm. When you start discovering that more and more and more people have this, now the denominator keeps getting bigger, but the numerator is staying the same. Okay, so again, simple math. If the numerator is 2 people died and the denominator is you tested 4 people, the death rate's 50%. Mm-hmm. When it's 2 people died and the denominator's 100 people, the death rate's 2%. And so again, yeah, people are getting sick and some people are dying. But the initial models that projected basically the end of the world, everybody from the CDC on down is admitting these were kind of over the top. And again, that's good news. You made a model and you projected a worst case outcome, and you put that worst case outcome out there so that people will take it seriously and be cautious and take prudent steps. But as more and more data comes in, we're finding out that this is not killing everybody that it touches. There's a huge number of people out there that probably never even know they had anything at all. But when we start testing more broadly, we're going to see huge numbers of people that have the antibodies, which means you got the virus and your body did its job, which was to fight it off.
So think about the cruise ships. What would you think that maybe we've learned from how many people got infected and how many people passed away from being exposed on a cruise ship?
Sure. I mean, that I think it was Princess Cruise Line, and if I've got the cruise line wrong, please nobody sue me for naming the wrong cruise line. But everybody remembers there was the one boat that came into California and they had it and they docked, and for a while they didn't even let anybody off because they couldn't figure out what the heck to do with them. Mm-hmm. And a handful of people did die, which is a tragedy, but it was a handful of people. It wasn't a dozen. It was, I think, 4 or 5 people died. And there were a couple of hundred people that were sick enough that they had to go to the hospital. But the cruise ship was one of those big boats, and it had something like 2,500 passengers on it and close to 1,000 crew members. And even after they decided that the COVID-19 was on the boat and they needed to try to protect themselves, locking everybody in their own staterooms, mm-hmm. It's one circulatory system. Everybody was breathing the same air. Everybody was being fed out of the same kitchen. It's a pretty, and again, everybody was on the darn boat together before they even realized, there's a problem. So to the best of my knowledge, they weren't able to test everybody for antibodies at that time. And again, even if you went back and tested them now, somebody could say, well, how do you know they weren't exposed to something else along the way? Mm-hmm. But if you ask me to bet $20, my bet is all 3,000 plus on that cruise ship were exposed, and we know it's contagious. So they essentially got the virus. Mm-hmm. Yet probably less than 10% of them were sick enough to go to the hospital. and only a handful actually ended up not making it. So again, doesn't mean it's not a real disease, but it's not everybody on the boat died. It wasn't a ghost ship found adrift at sea.
Mhm.
And the problem is, this has gotten whipped up so much that I know there are a lot of people that are absolutely terrified, and they're just thinking that everyone that's exposed to this is doomed. And that's just not the case. And the fear, I think, is reaching the point that it's doing more harm than good.
Yeah. You know, kind of one of the statements you made kind of reminds me, I'm in Kansas. We have a thunderstorm going on right now. I don't know if you can hear the thunder. But in Kansas and other states where we have tornadoes, they would run the tornado sirens and they would put the warnings out, and people weren't taking enough action. And so they really amped up the language that they were using so that it would catch people's attention. In fact, it was shocking to us that have grown up and lived in tornado areas. The language that they used was so shocking. It really caught our attention. And we thought, oh my gosh, is this different than what we've had before? And then we realized, okay, they're trying to really make it clear how dangerous this could be. So if that's the case, that medical and political officials have been trying to make it really, really clear, they've done an effective job doing that. But then you do have to wonder if it's really causing other deaths and a lot of other destruction to people's lives. You know, we've just taken it so far the other direction. What's happening in New York and other places is just so sad, and it does make you feel like this is terrible. This, you know, it seems apocalyptic.
Yeah.
But in a
Well,
lot of areas where we live, we're not getting that much. It's just getting started in Kansas, so we don't know, really what's going to happen. But I do know that people are suffering and they're losing their businesses.
well, and the tornado's a good example. Okay, I mean, I grew up in Wichita also, so we all lived with that threat. But I think there are probably very few people in Tornado Alley that are terrified all summer long that tonight's the night the tornado's going to hit.
Mm-hmm.
Some are more worried than others, but most people aren't sleeping in their basement from spring until fall.
Right.
And it's important in all of life to go back to almost like the step in AA. Understand the difference between the things you can control and the things you can't. But a big difference is with the virus, whether or not you get deathly ill in large part depends on your immune system. And if you're terrified of a tornado, you very well may give yourself an ulcer or hives or all sorts of psychosomatic illnesses. But it doesn't make it any more likely that the tornado hits your house. Mm-hmm. Chronic stress raises the fight or flight hormone cortisol in your body. And long-term elevated cortisol depresses your immune system. So these people that are the most afraid of getting the virus are actually putting themselves at greater risk because they're harming their own immune system. They're making themselves more susceptible, not just to the virus of COVID-19, but more susceptible to catching a cold or coming down with real flu. Influenza's still out there. Or for that matter, coming down with cancer. We see a lot of studies where major life stressors tend to occur shortly before women are diagnosed with breast cancer. And there's a lot of science that suggests this terrible thing happens in their life, like the death of a spouse or losing a child. They have this terrible stress response. It depresses their immunity, and all of a sudden, something that was smoldering takes off and they've got full-blown cancer. Mm-hmm. So again, I'm not telling people to be cavalier or ignore this, but you have to put things in perspective, and you have to be cognizant of what's detrimental to your health. And staying up all night, not sleeping, is not going to make you safer from the virus. It's going to make you more likely to get sick from a virus.
And a lot of people are complaining about not being able to sleep and about having really unusual dreams. And so sleep is a big concern. I sleep fine, you know, but you've got to feel for all of the people that are out there talking about it.
You know, I think in terms of, again, saying let's take control of what you can and can't control, we're seeing now very clearly that every place that we look, not just anecdotal, but real collection of numbers from places like NYU, comorbidities, other health problems, are directly related to the likelihood of whether you're admitted to the hospital with COVID-19. Again, admitted to the hospital. Again, I strongly believe there's a huge number of people that get this and we never even know that they don't even know that they got it. But the people that are going to the hospital, the people that are then being admitted to the ICU, the people getting on ventilators, the people not making it out alive, better than 90% of them have one or more other health problems. Now, the top two are age over 65 and obesity. Now, we're talking to mostly an older crowd, and I don't want everybody to suddenly clutch their chest and panic and say, oh God, I'm over 65, I'm dead. Mm-hmm. You have to realize that when they look at ages and they say, okay, the number one risk factor is over 65. Well, what else are we seeing? We're seeing that a large number of studies are showing the majority of deaths are coming from nursing homes. Mm-hmm. And you don't go to the nursing home just because you're 65. Maybe you got tired of mowing the lawn and you went to assisted care so somebody else would mow the lawn and pick up. That's fine. Mm-hmm. But a big part of that older group, we're not talking old in terms of just years past. We're talking elderly. We're talking about people that have become frail, who have multiple illnesses. And guess what? These are the people that die of influenza every flu season. These are the people that fall, break a hip, and die just from the complications of breaking a hip, okay? We're all old enough that we grew up watching Mutual of Omaha, okay? I'm going to go climb the tree while Jim goes down and wrestles the ferocious tiger, okay? But we saw week after week on Mutual of Omaha the cheetah or the leopard taking off after the gazelle herd. And it doesn't catch the strongest gazelle. It catches the weak one. It catches the sick one, the feeble one, okay? This virus is the cheetah running through our herd. And it's not going to pick off the healthy people. Yes, some healthy people get this. There's an exception to everything. But vast majority, over 90% of cases, it's the people that are already ill that are coming down with it in a bad way, okay? And the most factors that lead you to being frail in the nursing home are factors that you have some control over. You can choose to eat crap, or you can choose to eat healthy. You can choose to exercise or not exercise, take your vitamins, not take your vitamins. And again, the same thing with obesity. If you're 68 years old, I'm sorry, I can't make you 64. But if you're overweight because you chose to be overweight. I'm sorry, end of story. COVID's not going to let anybody have any excuses anymore. What you're eating is the single most important determinant of whether you're overweight or not. And the number 2 factor is how much you're eating, and the number 3 factor is your activity level. So people are scared, they're hiding, and they say, I'm going to have me some comfort food, and they whip up a bunch of mac and cheese. Well, that pasta is the worst thing on earth you could be eating if you're trying to lose weight. You're eating something full of sugar You're jacking your blood sugar up, which jacks your insulin up, which causes inflammation and causes your body to store fat. And obesity is the biggest controllable factor for whether you become deathly ill with this or not. So rather than hide at home feeling hopeless, you can lose weight in a month. And you can't get to the grocery store that often anyway, so just quit picking up the Twinkies and the Ho-Hos when you're there. The one time I went to the grocery store, I was heartbroken that all the junk food was gone off the shelves and all the fresh produce was still sitting there. Wrong choices, people. So you need to say, if you're really scared about this, I'm scared, what can I do? Let your concern be the motivator. Mm-hmm. Be the reason, your why you're going to lose weight. And as soon as your why becomes big enough, the how becomes self-evident. You quit shoveling in the chips. It's that simple.
Mm-hmm. Yeah, because people are really talking about comfort food right now. And when we probably all know it should be just the opposite. So, in losing weight, what would be your suggestions on how people might consider losing weight? What do they need to change?
Step one is eliminate sugar. Not cut back, eliminate. And by sugar, I don't mean just table sugar. Obviously, high fructose corn syrup, okay? You got to throw the Mountain Dew out. Processed simple carbohydrates, some of them are absorbed into your body as blood sugar faster than table sugar is. So the grain products gone. No bread, no pasta, no rice, no white potatoes. Fruit, bye-bye. It's full of fructose. Tropical fruits are the worst. You see people going, oh, I eat healthy. I have a banana every morning. No, you just jacked your blood sugar up every morning. Now, again, once you have your weight where you want it, once you're in good health, an occasional piece of fruit, that's fine. There are good things in fruit. But if you're 100 pounds overweight, you're not going to lose that weight by saying, well, I'll have half of a cinnamon roll. You're not going to lose weight by saying, well, I'll just have one banana instead of two bananas. Mm-hmm. This is biochemistry. And what counts is how rapidly the food you eat increases your blood sugar. Real vegetables need to be at least 60% of what you're eating. And corn and taters aren't vegetables, they're starches, okay? Broccoli is absorbed very slowly in your body, so your insulin level doesn't skyrocket up. And the problem that we have with eating something that's sugary, which by the way includes a piece of bread, your blood sugar skyrockets, your insulin chases that up, the insulin drives your blood sugar into your cells. And by the way, if there's more sugar there than your cells can use, the place it's going is your fat cells. But now your blood sugar's low, your insulin's still high, you're hypoglycemic, you're hungry and cranky and irritable. So just as your insulin was coming down, you decide, I need to have that bagel. Your blood sugar goes back up again, and your insulin chases it right back up. Mm-hmm. Oh, did I lose you?
We lost your camera. We can hear you. We just lost your camera. I don't know if it might be, oh, there you are, you're back.
Sorry about that.
No, what about losing weight fast? Because sometimes you hear it's not good to lose weight quickly.
Well, most people that lose weight quickly, what they've lost is water. They've dehydrated. To really change your weight, you change your lifestyle. I don't like the term diet in terms of a fad diet. Atkins works great. Why? Because it's not what you were eating. I tell people, if you don't like standing in the corner over there, you got to quit walking in that direction. You got to do something different.
Mm-hmm.
So you get off the sugar and you get off vegetable oils. Coconut oil is good. Olive oil is good. Butter is great. Lard is okay. Bacon fat's delicious. Mazola, canola oil, corn oil, they're highly toxic. They hurt your immune system. They disrupt your hormones. They make you put on weight. So the thing you do is you get rid of the crap. And surprisingly, a lot of people, if they'll just eliminate all the garbage, will lose a surprising amount of weight very quickly. And the people that say it's not working are the people that have just cut back. And again, it's your biochemistry. If you have just a little bit of sugary food, every time you do it, it's spiking your blood sugar, spiking your insulin. You know, I always say, if you're trying to get off heroin, you don't cut back. You stop it. Nobody says, oh, good, I'm only taking a little bit of crack. No, you're on it or you're not on it. You got to quit it.
Mm-hmm.
And again, the reason that diets work and diets don't work. You pick the diet you're going to go on, which is not eating what you used to eat, which is the standard American diet that abbreviates SAD for a reason.
Mm-hmm.
So your weight starts getting better. But then one of two things happen. You reach your goal, or you've picked a diet that's so weird you just can't stick to it anymore. You're on the all grapefruit diet and you decide, I can't live looking at one more grapefruit. And then what do people do? They go back to eating exactly the same crap they were eating before, and they're surprised that the weight came back. What you were eating before is why you've got a weight problem in the first place. You have to make a change. After you eliminate all the garbage, then you have to talk about portion control. The United States, I mean, nobody's going to Europe right now, but if you travel to Europe, what's going to strike you is serving sizes are way different over there. Okay. And so, you know, simple things like I say, don't eat off of the dinner plate, eat off of the salad plate, because you can be eating really clean, but if you're eating 50,000 calories a day, it's just not going to work. Now, again, I'm not saying starve yourself. Quit eating the garbage. You're not going to be hungry eating grilled chicken and steamed broccoli. And having just said portion control, I'm going to back up and challenge you to gain weight eating steamed broccoli, because you'll have it coming out your eyeballs before you eat enough of it to make you fat. But step two is be realistic on how much you're shoveling in. I always recommend people get a little notebook and you write down every single thing you eat. Most people aren't even aware of how much they eat. They graze throughout the day. You know, don't have the bowl of mixed nuts out on the table, because every time you walk by, you scoop up a handful and into the mouth it goes, and you're not even being cognizant of the fact you're doing it. And then again, the final step is increasing your activity. And I hear all these people say, well, I can't exercise, I can't get to the gym. Well, first of all, you can't outrun your fork. It's 80% diet, 20% activity. But if you're not exercising at home, it's because you don't want to exercise. There's plenty of exercise you can do while you're cooped up at home.
Okay. Well, we'll have to have you on again and talk a little bit more about nutrition and supplements. I know you have a lot to share on that, so that would be really interesting. And it's good to know that maybe we have more control than we think we do, hopefully, on keeping ourselves safe. And it's good to hear your perspective. So, and you and your wife are taking this seriously at home, and you just go into the hospital and work when you need to. What I do want to ask you one question though. What about surgeries that are being put off because they are elective? What's your thoughts on that?
This was well-meaning but catastrophic, and hopefully country's going to come to its senses and reverse this policy. Again, the rationale initially was well-meaning and not necessarily wrong, in that when the models first came out and we're talking about millions of people getting sick and hundreds of thousands of people dying, and all these people needing to be in the hospital. Okay, well, the hospitals had to say, well, gee, we need beds open to handle all the sick people. And again, it's a contagious disease. So we need gowns and gloves and masks for the healthcare workers. And again, going back to using gloves right, you're burning through a lot of them because you're not putting your gloves on and wearing them for an 8 or a 12-hour shift. You're changing your gloves every time you go from one person to another or one location to another. So it came down to saying, geez, what if we run out of supplies? Now, again, as thank God, we're seeing that the model's overestimated. And yeah, there are some places that are overrun, New York City being the obvious example. But even in the New York City metropolitan area, the Navy hospital ship hardly had anybody in it. The temporary hospital they built in the park hardly had anybody in it. There are other hospitals in the metro area that are not that full, okay? What happens in the meantime is employed doctors are being laid off, nurses are being laid off, and the hospitals are in danger of going broke because they have bills to pay just like everybody else, and they're not doing the things that they would normally do to keep the lights on. So aside from the fact that I'm getting nervous every day looking at my checkbook to see what's left because I'm not working enough to generate my income, elective surgery is elective when it's somebody else's surgery.
Yeah.
When you have a torn rotator cuff, which is very painful, and by the way, your orthopedic surgeon says, we can fix this for you, or we can wait 2 or 3 months and maybe it tears all the way through and retracts and now it's not fixable. When you have a herniated disc in your back and the pain going down your leg is so severe, you can't walk. When you have cataracts and you can't see to drive the car. When you have a moderate blockage of a coronary artery and you need a stent, but you haven't had the heart attack yet. All of these things are being called elective, and people are suffering, and people are going to have worse outcomes in the long run because they were forced to suffer with these conditions. People are going to have deaths. And again, from an economic perspective, let's back this train up. The worker out there who has been furloughed off his job, who needs his knee surgery because he tore his ACL and he can't have it yet. He's not working. He's not getting paid. His company also forced him to take all of his paid personal leave and burn up all his sick leave before he started getting his unemployment money. Well, now when finally Glinda the Good Witch comes and says, you can all come out now, well, the poor guy can't go back to work because he still has a torn ACL, but he's burned off all his sick leave time. And he's also burned through all of his life savings not working, and now he needs surgery, and he's going to have downtime and not work. A lot of people are losing their health insurance because they've lost their job. And so we're putting them off. They still need their shoulder surgery or their cataract surgery or their hernia repair. And it's being put off until now. They have no health insurance. So now what are these poor people going to do?
It's a disaster.
So again, early on, I'm not faulting Cuomo for dropping the hammer when he was afraid that he was going to have bodies in the street. But it's time to realize that even in a place like Wichita, where you've got more cases than I have in Rapid City, I'm pretty darn sure that Via Christi is not full to the rafters with COVID patients.
Right.
And that hospital is not going to be able to afford to stay open and offer care if we keep it indefinitely suspended from doing these quote unquote elective cases. And again, when it's your leg that hurts, it's not elective. It's an emergency for you.
Absolutely. And if you're going to lose your health insurance because you aren't getting your surgery done in time, it's horrible. And I've been in a position where in 2003, I had a car accident and broke my foot, and I couldn't understand why I had to wait so long to get my surgery. And I thought, boy, if this was going on, I'd really be waiting a long time. And that's miserable, just to have a broken bone wrapped up. And yeah.
So, as we're seeing now that, like I said, it doesn't appear that it's going to be the avalanche of cases that everybody was afraid that it was going to be. It's time to back up and take a look at things and say, wait a minute, there are hospital beds sitting empty, and there are gowns and gloves enough to go around, and it's time to start taking care of people's health and providing the care they need. Because again, you can say whether it's emergent or urgent, but I like to think that I never do an operation that's unnecessary, which means every surgery I do is necessary. And in this day and age, the insurance companies watch all of us like a hawk. You can't get permission from the insurance company, whether it's Blue Cross or Medicare. You can't do anything until you've jumped through the hoops and met other people's criteria that this is something that really needs to be done. So it's time to dust ourselves off and get back to doing this. And as we open the economy up in steps, I personally think opening the hospitals back up makes a lot more sense than opening up the tattoo parlors first.
Yeah.
Not to piss off your tattoo people, but it's a good place to get started because people out there need these services.
Well, and it's so political that if you were to talk about we need to open the hospitals back up, we need to open up more businesses, then there's a lot of the population that believes that, oh, well, you're all for people dying then. You don't care about people dying. And I don't know what's so hard to understand about people are dying and having horrible circumstances because of the closures.
Yeah, I mean, people commit suicide because of their chronic pain. And again, the person that needs a cardiac stent and it's postponed and they die of a heart attack, that's a real death. That's somebody that lost out because of somebody else's fear.
Well, I hadn't thought about that, the people committing suicide due to chronic pain. I'd thought about people committing suicide due to dire financial situations, because the real estate shift hit my business so hard in 2008 to 2012. And I know a lot of realtors around the country committed suicide during that time. And I'm very concerned about all of the business owners, from the food truck people to salon owners and restaurant owners, and just all the people out there that are, some of them are losing everything due to this. And but yeah, I think something's got to be done. Well, thank you for sharing some perspective on this. And we appreciate your encouragement on getting healthy and keeping our immunity up and not getting so caught up in the chaos, you just have to stay calm and kind of go with the flow of all the chaos that is outside of your control. And meanwhile, I think it's good that we've got some voices speaking for the people that are being hurt from the shutdowns. So.
Yeah, it's my pleasure, and hopefully we can get together again soon and talk about some other topics. But in the meantime, like I said, everybody at home, be careful, practice good hygiene, don't panic, don't freak out over the things you can't control, and gather up all the junky, crappy, sugary food in your pantry and give it to somebody you don't like.
All right. Thank you so much, Dr. Watt. Okay. And thank you for watching. We appreciate you being here, and watch for another episode. Let us know if there's any questions that we can answer for you. Reach out anytime. Thanks so much. Okay. Oh,